Hi, I'm Catherine.
I'm Shelby.
Hi, why are you here today, Shelby?
School physical.
Is it just for school, or have you been having any problems or anything?
No.
How about pain?
No.
I'm going to ask you some questions, and I need you to tell me, do you know where you are?
Memorial Hospital.
What day is this?
Saturday,
What's the date?
April 27th,
What's the year?
2013.
Good. Patient appears stated age of 15. Alert, oriented ×3. She's dressed appropriately for her age. The skin color is tan, even pink. Have you had these moles or freckles, or any of them new?
No.
Skin, I'm going to touch you, okay? It's warm and dry. No lesions are present. Posture, when she walked in, she was comfortably erect. She's sitting comfortably, arms are at side, gaze is looking at me, and pleasant expression, cooperative, no obvious physical deformities. Gait was normal when she was walking in. There was no use of assisted devices. No involuntary movements were noted. It looked like she had full range of motion from walking in here. Facial expressions relaxed and pleasant. Mood is pleasant, and she's been cooperative. Speech, when you answered my questions, was appropriate. Content was appropriate. And is English your first language?
Yes.
Hearing, when she asked the questions, there's no hearing deficits noted. She's not asking me to repeat any questions. She's well groomed. Hair is clean. Brush pulled back into ponytail. Makeup is appropriate for her age. Now I'm going to touch you, and I'm going to get your radial pulse. Radial pulse is 2+ and equal bilaterally. Now I'm going to touch your head, okay?
Mm-hmm.
Now, do you feel any pain or tenderness?
No.
The head is normocephalic. There's no lumps, bumps, or tenderness. Face is symmetrical. Now I'm going to palpate your temporal artery. Now, when I palpate here, I'm going to ask you to open and close your mouth a few times. Can you open and close? And is there any pain?
No.
Can you do it again? Now, what I'm going to do is palpate your sinuses. Now, tell me if there's any pain on your maxillary.
Nope.
I'm going to do your frontal. Any pain?
Nope.
I'm going to ask you to put both your hands on top of mine. Skin is even, warm, dry. It appears intact. There's no lesions noted. Can you turn them over? And turn them back over. Okay. No dehydration noted with turgor. There's no clubbing. Nail beds are ramp curved. Prompt capillary refill. Nail beds are smooth and even. Now, what I need to do is actually look and shine a light into your eyes at this time. Actually, we're going to do eyes first, now I'm going to test for confrontation, okay? Now, with this, what I need you to do is put it over this eye. And I'm going to put my hands, and when you can see them in your visual field, you say when, okay?
When.
Let's switch eyes.
When.
Good deal. Now, what I'm going to do is we're going to check your 6 cardinal points of vision. And you're going to track my fingers with both eyes, okay? So track. And we're going to do 6 points of gaze here. Now I'm going to switch fingers. Can I have the card, please? Now, what I'm going to do is we're going to dim the lights. Dim the lights. The corneal reflex is present in both eyes bilaterally. and it's in the same place in both eyes. Can you turn the lights on, please? What I'm going to ask you to do is look here, and we're on test for accommodation, and then look here, now at my finger. Look at the wall, and now at my finger. Okay, the external eye structures. Eyebrows are present and symmetrical. The face is symmetrical. The hair is distributed evenly. The eyelashes are distributed evenly. What I'm going to do now is I'm going to pull down. I'm going to look at your conjunctiva. Conjunctiva is clear. Sclera is clear. We're going to turn the lights out. Pupils resting are 3 mLs, constricted they're 2 mLs. I'm going to shine this light across and I'm going to look at your corneas. There's no opacities noted in the corneas, and the irises are round in both eyes. Now, we tested the pupil size, and we've already done for the light and accommodation. So what I'm going to do is I'm going to check and shine a light into your eyes. This light can be very bright, and you're going to see my face getting closer, okay? Now I'm going to hold up and hold your eyelid open. Now I'm going to go to the other eye. The red reflex is noted in both eyes. The optic discs are creamy yellow-orange in color. They're round. They're sharply demarcated. Vessels were noted in all quadrants, and the background was clear. Can you turn the lights on, please? There was no hemorrhaging noticed or exudates. There was no lid lag noted, and no ptosis, and no nystagmus was noted. Hi. Now what I'm going to do now is I'm going to inspect your ears, and I'm going to touch your ears, and I need you to tell me if there's any tenderness or pain.
Nope.
No pain?
Nope.
Is we're going to inspect your ear. Can you turn your head a little toward me? Thank you. Okay. The canals are clear. The tympanic membrane is pearly gray and intact. What I'm going to ask you to do is we're on test for your hearing. Have you had any problems hearing or anything?
No.
Okay. I'm going to ask you to put your fingers here, and I'm going to do the whispered word test, and you're going to go back and forth, and I'm going to whisper some words, and you're going to tell me what those are.
3,
6,
6,
4.
4.
Again, put your fingers here, do that. 2,
2,
8,
8, 4.
Good deal. Have you ever had any problems with hearing or anything?
No.
Okay. There was no pain. There was no tenderness to palpation. Your canals were clear. The tympanic membrane was pearly white. Inspect your nose. Okay. I'm going to palpate here, and now we're going to check for your nares. I'm going to occlude one. Take a deep breath in through your nose. And let's do the other one. Nares are patent. Now I'm going to inspect your nose. Hopefully it won't get stuck in there. Okay, tilt your head back. Nares are patent. Mucosa is pink. There's no lesions. Your septum was midline. And there was no preparations. You've had no problems breathing or anything. What we're going to do now is inspect your mouth, okay? Can you open your mouth for me? Okay, can you bite down? Normal occlusion. Teeth are white, evenly spaced. Have you ever had braces?
No.
Have you had any teeth pulled?
Yes.
Do you know how many you've had pulled?
3.
Okay, open your mouth. Can you put your tongue on the top of your mouth? Can you stick it out? Put it back in. Okay, I'm going to stick this in your mouth. I'm going to press down. Tonsils are not present. Can you say ah? Now I'm going to test your gag reflex. Okay. Gag reflex present. The hard palate was white. The soft palate was pink. Teeth were evenly spaced. Mucosa was pink. Gums are pink. There's no pain. There's no lesions. Open your mouth. In your mouth. Have you had any problems, cavities or anything?
No.
And uvula was midline when you said ah. Tongue was pink, moist, midline with no lesions. Okay, I'm going to inspect your neck now. Symmetry is noted. Skin color is even. You have a tan on your shoulders. There's no lesions noted. Skin is warm and dry. There's no lumps or pulsations. Any pain or anything?
Nope.
Now I'm going to palpate your cervical lymph nodes now, okay? Any pain or tenderness?
Nope.
Now I'm going to tilt your head a little over here. Okay, let's go to the other side. What I need you to do now is kind of put your shoulders forward. That's it. You can breathe. No pain or anything?
Nope.
Okay. I'm going to palpate your trachea now. Your trachea is midline. Now we're going to test your muscle on your range of motion, okay? Let's shrug your shoulders. Tilt your head forward. Let's put your chin up. Put your head midline, ear to shoulder. Ear to shoulder. Now we're going to do it against resistance. My hands are here. Shrug your shoulders. Now, put your ear. Good. No limitations with range of motion, no pain or difficulty. Now what I'm going to do is we're going to test for your carotid pulse. I'm going to palpate down. Carotid pulse is present. It is equal bilaterally. Now I'm going to have to press down a little harder with the stethoscope for the bell. No bruise noted. Now I'm going to give you a glass of water, and what I'm going to ask you to do is I'm going to look at your thyroid. I'm going to ask you to take a sip of water in a second. Now take a sip of water. Can you swallow it for me? Good. Can you do it again? Take a sip of water. Now what I'm going to do is palpate as you swallow. Thyroid is non-palpable and non-tender. Now I'm going to look and see at your thoracic cage, and we're going to look for configuration, and I'm looking at skin characteristics. Your skin is warm and dry. You do have a tan line here. You do have some peeling, And you do have freckles. Are any of these freckles new?
No.
There's no lesions noted. Skin is tan, lightly tan with some pink. Symmetry is noted in the thorax and the scapula. Now I'm going to go down and we are going to do chest for symmetric expansion. So I want you to I'm going to pull your tank top tight, take a deep breath in and exhale. Chest expansion is symmetric. Take a deep breath in and exhale. I want you to say, I'm 99, and we're going to say this a couple of times, okay? Can you say 99?
99. 99. 99. 99.
Fremitus is symmetric. There is resonance noted. When I palpate, is there any tenderness?
No.
There are no lumps noted. The Spine's process appears to be in a straight line. As I palpate, let me know if there's any pain. I'm going to palpate or percuss your lung fields now. Now, I'm going to lift up your tank top, okay?
Mm-hmm.
I'm going to have to write on you, okay? But I'm looking for your diaphragmatic excursion. I'm going to ask you to take a deep breath in, exhale and hold it. Okay. Can you take a deep breath in again and hold it? Okay, I'm going to go over to the other side, and we're going to do the same thing, okay?
Okay.
Do you want to take a regular breath just to catch your breath? Okay. Take a deep breath in, exhale, and hold it. Okay. Take a deep breath in, and you're going to hold it on the inhale. The diaphragmatic excursion is equal bilaterally, and it's approximately 4 centimeters. What I'm going to do now, I'm going to pull your tank top down and tight. I'm going to palpate for CVA tenderness. Is there any tenderness when I do this?
Mm.
Okay. I'm going to listen for breath sounds now. Can you take a deep breath in? And exhale. Deep breath in. And exhale. Deep breath in. And exhale. Again. Breath sounds are clear. There's no irregular breath sounds. Breathing is unlabored. Okay, we're going to look at the anterior chest. Symmetry is noted. Skin is warm, dry, and intact. You do have some nevi noted. None of this is new. No lesions. tannish pink in color. You do have a tan line with some redness and peeling noted right here. I'm going to ask you to say 99.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
Tactile firmness, there's symmetry noted. Now as I palpate, is there any lumps or tenderness?
No.
Now I'm percussed from the front your lung fields. I'm going to listen for breath sounds again. Take a deep breath in and exhale. Deep breath in. Breath sounds are normal. There's no adventitious breath sounds noted. Breathing is unlabored. Any shortness of breath or anything?
No.
Okay. I'm going to ask you to lean forward. Okay, and come back. Now what we're going to do is we're going to test your range of motion. So I want you to put your arms out. Let's go up, back down, bend it in, up, go behind your head, back up, and forward. No limitations in range of motion. Now, I want you to tell me if there's any pain or tenderness at this node. This is the epitrochlear node, and there's no pain or tenderness. Okay, I'm going to listen to your heart now, and we're going to listen for heart sounds, okay? Okay, we're going to listen to your heart sounds now, so I'm going to ask you to go ahead and lay down here. I'll cover up your lower extremities. Okay. There's no pulsations or heaves noted. Okay. I'm palpating for the apical impulse. Now I'm going to ask you to turn over on your left side, okay? Okay, lay back down. Now I'm going to palpate for any thrills. There's no thrills or heaves noted, okay? Now I'm going to listen to your heart. I'm going to press down and listen with the bell for any murmurs. And I'm going to listen with the apical. S1 and S2 heart sounds were heard. There were no abnormal heart sounds. There was no murmur noted. The apical pulse was regular and even. Shelby, we're going to inspect your abdomen now. So I'm going to pull up your tank top. Okay? And I'm looking, you have a normal contour. There is symmetry noted. Your abdomen is flat. The skin color is tan, kind of lightish tan. You have a couple of nevi noted. Are these new or have you always had them?
Always.
Skin is warm, dry, and intact with no lesions noted. Umbilicus is midline. There are no pulsations. Now I'm going to listen to bowel sounds. Sorry if this is cold. Bowel sounds are present. Now with the bell of the stethoscope, I'm going to press down and listen for vascular sounds starting with the aorta. We're going to go to renal arteries. Iliac. And then femoral. Now I'm going to start with percussion. There were no abnormal vascular sounds noted. Is there any pain?
No.
Now I am going to do for the liver span. Sorry if my hands are cold, okay? So what I want you to do is just lay here. Sorry, ticklish. Liver span in the right MCL is approximately about 7 centimeters. Now I'm going to go over here for the spleen. And I am unable to percuss the spleen. Now know that you're ticklish, but I'm going to palpate. I'm going to start here. We'll start with light. I'm sorry if you're ticklish. Any pain or tenderness?
No.
Okay, I'm sorry. Now I'm going to go under here with my hand. Okay, just relax on my hand. Take a deep breath in. And exhale. I'm going to do some deep palpation. I'm unable to palpate the spleen, the liver, and the aorta. Now I'm going to test for abdominal reflexes. Sorry, ticklish. Abdominal reflexes are positive. Now I'm going to go down and I'm going to check for femoral pulse. Sorry. Femoral pulse is equal bilaterally. Now I'm going to palpate for inguinal nodes, okay? Any pain or tenderness?
No.
Okay. Unable to palpate the inguinal nodes. Now I'm going to pull this down. I know that you're cold, so we're going to pull this up. And we'll uncover and look at your lower extremities. Skin is tan and smooth, even. There are nevi noted. And are any of these new?
No.
Skin is tannish pink. There's no lesions noted. No lesions between the toes. Okay, what I want you to do, we're on check for range of motion. I want you to lift that leg straight up. Good. And put it back down. Let's lift this leg straight up and back down. Can you bend the knee toward your chest? And repeat it on this leg. Okay. Can you point and flex your feet? Now what I would like you to do while we're laying down is put your heel on this shin and go up your leg. Okay, and can you do it on this side too? Now I'm going to check for pulses. Popliteal is equal bilaterally. Posterior tibia. Dorsalis pedis. There's no edema noted on the tibia or on any of her extremity. Skin is warm and dry. Can you sit up now? Here, let me help you sit up, okay? Normal range of motion when she sits up and in all extremities. There was no limitations in David. Now, what I'm going to do, let's get you covered up here. We're on test for sensation. Are you warm enough? Okay. We are going to do dull and sharp, and then test for sensation with this too on your face. Now, when I'm testing for sensation, do you feel that? What is that?
Sharp.
And then?
Dull.
Okay. And do you feel that? Okay. Well, with your eyes closed, I want you to tell me when you feel, okay? Okay. That was good. What do you feel?
Sharp. 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 Flat. 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 Flat.
Very good. Now, we're on test for vibration, okay? Do you feel any vibration? Patient has normal sensation in all extremities. Vibration was noted in her, in both feet. Now I'm going to give you, close your eyes, an object, and we're on test for stereogenesis. With your eyes closed, I'm going to place this object in your hand. Close your hand. I want you to tell me what you feel.
Key.
Good deal. Okay, let me have your hands. We're on test for position, okay? I'm going to go up and down with your finger. And with your eyes closed, you're going to tell me what position I'm in, okay?
Up. Down. Up. Down.
Good deal. Let's go to your other hand. Same thing.
Up. Down. Up. Down.
Okay. Open your eyes. I'm going to put my finger here. I want you to touch your finger to my finger and then touch it to your nose. And again. Good. And we've already tested your heel to shin while you were laying down, and that was good. You were able to go in a straight line. Now we're on test for deep tendon reflexes, okay? Now I'm going to hold right here, and I want you just to relax your arm. Relax your arm. Let's see this arm again. So for the biceps, triceps, and the brachial radialis, all positive reflexes were noted. Patella is positive in both. Achilles is positive. I'm going to lift your leg up, and I know you're ticklish on your feet. Try to relax, okay? I'm sorry. Sorry. Let's go again. Okay, and negative Babinski noted. Okay, Shelby, I'm going to ask you to stand up now. I'm going to uncover you. We're almost through with the physical at this point. Okay, I need you to stand up, and now I'm going to ask you to walk toward the door. Just walk normal, okay? Gait is normal. Smooth, even. Gait is about a foot width apart. Now I'm going to ask you to walk on your heels, okay? Can you walk on your heels? Good deal. Okay, turn around to me and walk on your toes. Okay. Now, I want you to stand, put your feet together, heels together. Okay. Close your eyes. Romberg test is negative. Okay, open your eyes. Get about a foot width apart, and let's do some knee bends, okay? On one foot, lift one foot and slightly do a knee bend. Okay, let's do it again. You can do it. Good deal. And up. Let's do the other one. Okay. Now, if you can step over here a little. Okay, I'm going to stand behind you. What I'm going to ask you to do is bend over and touch your toes. Okay, we have normal flexion noted. Now I'm going to ask you to go into extension and lean back toward me. Okay. Stand up straight. Now I want you to act like you're a teapot and go over to the side, back up, over to the other side, and back up. Now, can you lean over and touch your toes one more time and let me look at your spine? There's the normal curvature of the spine. Nothing abnormal, no kyphosis noted. Come back up. Is there any pain when you're doing these range of motions?
No.
Range of motion. Let's go ahead and twist to the side. Okay, and twist to the other side. Any pain?
Good.
Okay. You have normal range of motion with no limitations, and there was no pain noted. In the back of your legs, skin is even. There's no varicose veins noted, no no lesions, and skin is warm and dry. If you want to, if you could just sit back up here, we're almost through. We're finished with your physical. Everything was normal, which is a great thing. Everything is normal. There was no problems. You don't have anything that's abnormal, so your follow-up would be in a year, okay? So I'll write out all the forms that you need for your school physical. Now, have you ever done a self breast exam?
Mm-mm.
Okay. What I'm going to do is I'm going to teach you how to do one, and then you're going to repeat, and then I'll answer any of your questions. Now, I wanted to thank you for your time today and coming to see me. Thank you.